I was in high school and college here in Goshen. And while I was in college, I was living in an intentional household with 5 young adults. Some folks were involved with the county home, some with Big Brothers Big Sisters, Boys and Girls Club, a variety of things. And in the course of that, became aware of how many of our neighbors didn't really have adequate access to affordable healthcare. And so I really started thinking about what it would be like to do healthcare as a way of being present in the neighborhood and thinking about healthy community, where people come together across the normal boundaries that would separate them. I really went to medical school not to become a doctor. I went to medical school to do this project. There was this fire station on Middlebury Street. With the overpass, they suddenly found that trucks were getting to Northside fires quicker from the main station, and there really wasn't any reason to keep the station open. One day the mayor called me up and said, you know, I've got this building looking for a project, and I hear you've got a project looking for a building. Is there any way we can get together? So we ended up getting this old fire station. We got it up and running and started seeing patients there. From the beginning, we've had affordable primary care with up to 90% discounts so that people who didn't have insurance could afford care. We have 4 counselors plus a full-time psychiatrist plus an addiction counselor. We have social workers. We have nutritionists at each site. And so we're really reducing hospitalization rates among people. On the hospital side, they've seen that we have saved them a ton of money on keeping uninsured people out of the hospital. And on our Medicaid patients, we've seen that we save the system between 40 and 50% of their total healthcare dollars. So there have been some wonderful things that have happened in terms of just the medical side of things, but the underlying thing that's really the fun part is we see people connecting with each other and caring about each other and understanding each other's stories in better ways. It's hard for people who are hungry to think about what they have to offer their community and how to be part of a community. It's hard for people who are homeless to think about how to be part of a community and what they have to offer. And it's hard for people who are facing acute medical needs and are sick to think about what they have to offer their community. Treating the medical conditions and being there for healthcare is an important thing, but it's a way of creating a space in which community that can actually happen in. The first casualty of fear is always imagination. And what we're trying to do in this community is foster imagination about how do we be a better community and how do we do healthcare in better ways. And so I think one of the wonderful things about something like Junior Achievement is the way in which it both encourages imagination and encourages kids to dream. Imagine what can happen in authentic community and don't lose that dream. Don't sell it short. Don't sell it for a quick profit. Hold on to your dreams and pursue them. I just want to say I'm really honored to receive this award. I'm impressed always with youth and their engagement and how much mentoring and fostering the gifts and the imagination of youth can make a difference in a community. And it's really helpful to have programs that are geared to helping to do that. And so I'm grateful for all the work that Junior Achievement does.